Hello, this is your 10-minute milk bite on Plan A exclusive breastfeeding. So this is if you would like to exclusively breastfeed, that is your plan going into this, and I'm going to cover what I think you need to know to be successful in that mission. Let's start with pregnancy. You are a mammal, and so you make milk. That is by definition. Colostrum is in the breast by about 16 weeks. It is done. Now remember, early pregnancy, you probably have some kind of changes in your breast going on, tenderness, sore, itchy, these kinds of things are happening. Maybe some breast growth is happening. That is your mammal body getting ready to feed the baby that you're growing. By 16 weeks, it's done. The colostrum is there, it is ready to go. Colostrum is milk. You may see leaking, you may not, both are normal. I don't recommend in general that people are collecting colostrum because your pregnancy hormones are keeping your lactation system on the off switch. Pregnancy hormones suppress lactation is another way to say that. It's not until your baby is born and your placenta is delivered that your hormones will shift, and those lactation hormones can come online, as I like to say, and do their job, which is to increase your milk supply. So when you're pregnant, you're going to get a teeny bit if you try to extract. It's a lot of work. Pump doesn't usually work great for colostrum since it is thick and sticky. So you're doing hand expression a lot of minutes for like drops. And I see a lot of my clients get very frustrated and anxious about what this means for breastfeeding. It doesn't mean anything. So my general recommendation is sit back, enjoy your pregnancy. There's plenty of time for feeding your baby later on. When you do give birth, you do have that shift in hormones. That colostrum is there for the baby, and bringing the baby to the breast is the thing that starts this system kind of going. So hormonally it's going because your pregnancy hormones have dropped, and so lactation hormones are just kind of saying, oh, the baby's on the outside now. What are we doing? Are we making milk? And the baby at the breast is saying, yes, please. So breast stimulation, removal of colostrum, all of this is working to kind of get lactation going. This is something that you'll just be watching your baby and know that a healthy full-term newborn is asking to be fed at least 8 times in 24 hours, usually more than that, 8 to 12, 8 or more in 24. But if you're feeding 10, 11, 12 times, that's normal. And it gets tricky because newborns will cluster feed, which means there's probably a period in the day where they're kind of on, off, on, off, on, off. And so you kind of stop losing track and you say, well, this baby ate 20 times today. But some of those feedings were very small and close together. But 8-ish is what we're looking for to ask for the full milk supply. So that means if you're using some formula over here, if you did bring colostrum from home and the baby's eating it over here and they're not going to the breast as often as we would expect them to, that's impacting your milk supply. That's why we want to be mindful. It doesn't mean you can't use formula or colostrum you collected. It just means that you might want to start hand expressing here, pumping to get this system up and running, because now the baby's not doing it. And if you're feeding the baby over here but hand expressing over here, you might as well just put the baby to the breast, right? Skin to skin is helpful for this whole system as well. So this is for every baby. We have some really nice hormones running in the mother. If a dad or partner is holding baby skin to skin, they get some of these benefits as well. And the baby is getting these kind of safe, I'm safe messages, which helps everything in their body just go a little more smoothly. So this is for every baby. Heart rate, breathing, blood sugar, they cry less, all of these things. Temperature are better controlled when the baby's in skin to skin with a caregiver. Bonus is that they're in their restaurant if you're trying to breastfeed, and babies are born being able to tell you that they're hungry. And so a baby in skin to skin will start turning their head back and forth, opening their little mouth like a baby bird. Eventually they'll get their hands up to their mouth. They're going to make their way to the breast. You can Google the breast crawl and watch what that looks like. But just know that all babies are going through those little reflexes. They know how to tell you what they need, and they actually know how to get to the breast Now, if you had to have interventions during labor and delivery, I had to have a C-section, that changes what this baby might be able to do postpartum. But just know that those reflexes are there. And if you don't see them right away, they will come out as any medication in the baby's system wears off. So it's really good to keep this baby in skin to skin as often as you can, just for those health benefits in general, but then for the breastfeeding benefits, to have this early cue that the baby is ready to eat, and then they're going to kind of move towards the breast. You can help them if they need a little bit of help, and then let them do their thing. So this is getting lactation up and running. And this is how your milk supply works. The more milk that the baby is taking out, the more milk you will make. It is a perfect system when things are working perfectly. So again, the more milk the baby takes, the more your body makes. And if the baby's taking exactly what they need, then your body should be producing exactly what they need. So you can feed on demand. And we're going to talk about how you know this is working before the end of the video, but you feed on demand and just kind of trust this process. And again, we're going to have some objective measures. But like I mentioned, this perfect system works if things are running perfectly. That means that this is not hurting you. So there's a big myth out there that this is going to hurt, expected to hurt, normal to hurt, keep going if it hurts, your nipples will toughen up, they'll scab over. This is all very bad advice. It might be a little sore and tender for a few days as you're getting used to this, and you might have to try and redo the latch a few times. So to have some level of soreness, a little bit of pain, but it gets better when you get that nice deep latch, that's okay, as long as you're kind of like not in agonizing, toe curling, teeth gritting pain. How do you know for sure? Because you've never done this before. And so you're just thinking, well, I don't know. It kind of feels weird, uncomfortable. Is this pain or not? Is it normal pain or not? Your nipple will tell you the story. So you want to look for when the baby is finished, and some babies will come off on their own. Sometimes they'll just hang out there until you decide it's time for them to come off. Look at your nipple. Your nipple's telling the story of whether there was pain or not. And a nipple that is pinched, so there's like a line running across your nipple, it'll be a white line. Eventually it's going to bleed. That's bad. We don't want to get to that point. When you feel that pinch when you're breastfeeding, when you see the physical evidence of it, when the baby comes off. So it could look pinched, a stripe across the nipple, or it looks like a tube of lipstick where it goes out at the top and then slants down underneath. That is a sign that your latch is not as deep as it should be. Now at this point, some people go, but at least I'm breastfeeding. I'm going to keep going because I'm a good mom, or this kind of thing. Your baby's biting on their straw. So they're not taking the milk that they need, which means they're going to spend longer at the breast. They're going to be hungry more often, which means more nipple damage for you. And remember what I said about the more they take out, the more you make. They're not taking out what they need. And so that's giving a message to your body to make less. So if this hurts, don't keep going. That's not helping anybody. In fact, it could be really derailing your exclusive breastfeeding goals. So get some help right away in the hospital. First latch. Ooh, ouch, and your nipple shows you that that is a painful latch. Let's get some help. And I'm going to have a video about plan B. If we can't get comfortable now, what do we do? But we're assuming in this video that this does not hurt you. Now, how do you know that this is working? We don't just say, trust your body and everything's perfect. I want you to put some trust in the fact that you're a mammal and mammals make milk. But I also want to be able to measure that this is working for the baby, of course. Diapers are the best way. In the hospital, they should give you a paper to keep track, and you want to make sure the baby's hitting those diapers every day that they're telling you about. So wet diapers, poopy diapers, and then you want to see this color change in the poop over the first week of the baby's life. If you're seeing those diapers every day, increasing color change in the poops, such a good sign that the baby is getting what they need. So that's number one. Number two, they're going to weigh that baby a lot when you're in the hospital and then when you're discharged. And we expect to see some weight loss. They're taking little bits of colostrum. Colostrum comes in small quantities in those first few days. Baby's belly is very small. They want that thick, sticky liquid to learn how to eat, swallow, breathe. It's all designed by nature. There's no accident here. Like, where's all the thin, gushing milk on day one? this baby wants that thick, sticky liquid to learn how to eat, and it's higher in protein, keeps their blood sugar up if they're getting enough of it, which we know through the diapers. See a little bit of weight loss. And if we're at 10%, you're going to start to get some interventions from the hospital's end. And the other way that we know that this is working is the baby will tell you. So babies have that language I mentioned, hands to mouth, tense, tight fist. I'm hungry. They relax during the feeding. I'm full. Feedings are taking 10 to 40-ish minutes-ish. It's going to be different every time. That's kind of a range of normal. If it's faster than 5 minutes every time, if it's longer than 45 minutes every time, I would be a little nervous and want to have a really good look at everything together. But so that's the average amount of time you're spending feeding the baby, about 8 times a day. You're getting these 2 to 3 hour stretches in between, maybe one longer stretch of sleep every day. That for a baby is 4 or 5 hours. Again, that's normal and healthy as long as we're hitting minimum of 8 feeds. Diapers look good. And then cluster feeding is pretty normal. And that's where you don't get that 2 to 3 hour stretch. You get this like snacking on, off, not happy, put them down, they're awake 15 minutes later. Once a day for 2 or 3 hours, that's a normal, not fun, I call it. Normal, not fun newborn pattern. But it is a sign, again, that your baby's doing exactly what we expect them to do, and it's only contained in that one portion of the day, and everything else is kind of talking or reflecting what I'm talking about, then you're doing a great job. Now, what if any of this is not working? It is hurting. The baby didn't latch at all, or they're latching, but you just can't get comfortable. Or we see that we don't see the diapers, or we're getting really worried about the weight loss. We're going to move on to plan B, which is going to be tagging the pump in hand expression for the baby. So if that feels like something you would like to explore, I will have another video on plan B when exclusive breastfeeding is not working. So I hope this has been helpful for y'all. That was 12 minutes, not 10 minutes, but who's counting?